Nail fungus is a common infection of the nail. It begins as a white or yellow-brown spot under the tip of your fingernail or toenail. As the fungal infection goes deeper, the nail may discolor, thicken, and crumble at the edge. Nail fungus can affect several nails. Symptoms. Symptoms of nail fungus include a nail or nails that are thickened, discolored, brittle, crumbly, or ragged, misshapen, separated from the nail bed, smelly. Nail fungus can affect fingernails, but it's more common in toenails. Causes. Nail fungus is caused by various fungal organisms, fungi. The most common is a type called dermatophyte. Yeast, bacteria, and molds also can cause nail infections. The discoloration from a bacterial infection tends to be green or black. Risk factors. Factors that can increase your risk of developing nail fungus include older age, wearing shoes that make your feet sweat heavily, having had athlete's foot in the past, walking barefoot in damp public areas such as swimming pools, gyms, and shower rooms, having a minor skin or nail injury, having a skin condition that affects the nails, such as psoriasis, having diabetes, blood flow problems, or a weakened immune system. Thanks.